Welcome back. Well, if you're concerned about your child's speech or possibly their language deficits, we've got some great information that can help you determine what you should do.
Kyle Meads of Therapy Group of Tucson is here to give us more information. And Kyle, we actually want to start this off kind of by celebrating something, what you guys do, and how are we doing that today?
Hey, thanks for having me on. It's always a pleasure to be here. We work with kids and adults with speech and language problems, and I wanted to take the opportunity today to celebrate a little guy that we've been treating for at least 2 years now.
Sebastian.
His name is Sebastian. That's my man. He's a great kid.
Yep.
So how did the parents know that there was a speech or language problem with Sebastian?
Well, when he was 4, the mom and the dad, they kind of thought it was a phase. They thought that Sebastian would grow out of it. And so they took Sebastian to his pediatrician, and the pediatrician did confirm that, there was a problem. He was only speaking about 4 or 5 words when he was 4 years of age. So the first thing the doctor did was refer Sebastian over to the ear, nose, and throat physician, who checked his hearing to make sure he was hearing appropriately, and he was. And so the ear, nose, and throat doctor then sent him to us.
So what are the signs that the parents saw that indicated to them, we should actually seek some help? If parents at home maybe see certain things in their kids, what are the signs that they should be looking out for before they even contact a doctor?
The big thing that I hear, and I've done this for 24 years, the big thing that I see is my child's not talking, or he's frustrated, and that's exactly what Sebastian was exhibiting. He was having trouble getting his words out. Like I said, he was only speaking 4 or 5 words. When he did try to talk, his speech wasn't clear. He wasn't making friends. He was avoiding others. He was frustrated. He would cry. And so when we got him into the clinic, we did the speech and language evaluations. It's actually 2 different parts. We want to check to see if the child can express words, phrases, sentences, and also how well the child can understand. And we also test speech and speech sounds. So that combination of assessment gave us a great picture to go from, and we found out normal child, normal intelligence, can hear appropriately. He just wasn't using his words. So that's what we've been doing for the past 2 years. We've given him words, phrases, sentences, most of his speech sounds, and now the parents are telling us, he initiates, he's got friends, he doesn't cry anymore, he's overly confident, he's a normal developing child, and that's what we do with the office.
I love hearing that.
I know, this is I love when you come on and tell us this happy story like this, because it makes us feel like we're doing good work here.
Well, the main thing is you got to throw it back to the parents.
Yeah.
They're the ones who bring this child every week, and we want to help everybody that comes to our clinic, but the main thing is if the parents don't bring their child, we can't do our job, and we have to stress that. And we have a lot of families that cancel, and it's just not good for the child. So when families are on board and they do their part and they bring that child every single week, you will see the results.
Well, and for something so specific like these tests, this panel of tests that you can do and speech therapy, is there a waiting list that parents can expect? I'm sure a lot of them fear that and they say, I'll never get my kid in there, but is there actually a waiting list?
We really don't have a waiting list. There are other places in town that you might be waiting for 6, 8 months, 12 months, but we can get you in normally within 4 to 6 weeks. And we take most all insurances, all the access plans. We'll do all the hard work for you. You just need to get to us and bring that child in, and we'll take care of it.
So while we're talking about this, let's get specific on what things that maybe kids should be brought in for, or any age. What are the things that you're really looking at?
The disorders that we treat, absolutely. Speech problems, which is just basically sounds. Articulation problems, language problems, which is how well a child can express their wants and needs, or how well they interpret language, how well they receive information. Another thing that we see is voice problems. Kids who are screamers and yellers, they have vocal nodules. It messes up the pitch of their voice. Kids sometimes then have swallowing problems because their vocal cords are compromised. So we work with that too. Kids who have autism, kids who have developmental disabilities like cerebral palsy, Down syndrome, people who stutter. Those are all the things. It's not just your speech therapist. Let's just take the kid to the speech therapist these days. We work with a lot of things: attention, concentration, reading disorders. There's so much that we do.
Well, and it's such an important subset of medicine and health in general. I mean, we use our words every day to communicate. Kids need to develop properly, and when they go in for treatment, is there a typical window that they have to stay in treatment for, or does it depend, does it vary on the case?
You know, it does depend on the case, the etiology we call it. It just depends on how severe. You know, if you've got a child with ear infections, they're not saying their words correctly, you know, you might be looking at least 12 months of therapy, you know, weekly visits, 52 visits. You know, kids with developmental disabilities such as autism, Down syndrome, you know, you might be looking at something longer. So yes, it does depend on the problem.
Now, Kyle, I know I shared it with you last time, but speech therapy saved me. I had a drastic lisp as a child, and so in 3rd grade I went through this myself, and here I am.
Yeah,
No
I had the
lisp,
same
but-
problem.
Thank you. Yeah, and so I know
had
we
the
kind
same
of share
problem.
that. So real quick before we run out of time, do parents need a physician referral, or can they call you directly? How does this work?
You know, if you're going to use your benefits or if you have access, absolutely, we're going to need that doctor's prescription. So the best thing to do is go see your pediatrician, and 9 out of 10 times they know who we are. We receive a lot of referrals. But, you know, if you have any questions, just call the clinic. Our number's going to be on the screen there, and we'll walk you through the process.
Kyle, it's so good to have you on again.
Oh,
You're
thanks
bringing
again. I really
awareness
appreciate it.
to this very important topic, and I want to thank you again.
Thank you.
All right. And if you're in need of a speech and a language evaluation, call 232-2021 or log on to supportvoice.com.